And the other group of patients are the group of patients who are already using the medication. So I have people using medications for 10 years, 15 years, 20 years. They think they have to be on the medication for the rest of their lives. But then we incorporate these lifestyle changes. We talk about emotions. People are going through hurt. Their best friends have hurt them, family hurt, and all of that. We talk about all that. So this is actually you punishing yourself for what someone has done to you. If you decide to keep all these negative emotions, thinking I'll never forgive this person and all of that, it is you hurting yourself, punishing yourself as a person. So if they get it this way, they begin to work on it, they begin to let go, and even on the medication, the blood pressure begins to normalize, and then we reduce the medication and we reduce it until we come off the medication. Because with blood pressure medication, you can't just stop it at once. So we have to reduce it and reduce it and reduce it. And they're able to get off the medication just by adding lifestyle changes and proper stress management.
Shalom everyone, welcome to Barian Health. My name is Ryan and this is actually our very first episode. And today we are going to talk about a very interesting topic, a topic I believe is going to help you a lot. Right? Don't forget to like, share and comment. So the topic here that we are going to talk about is how poor emotional regulation can affect your health and even the drugs you take in. And today I have on set with me a very beautiful and a wonderful woman, and she's going to tell us a bit about herself before we move into the main event. So, Dr. Claire, tell us about yourself.
Hi everyone, once again, you're welcome to Barian Health. I am Claire Amakwata, a professional medical doctor. I actually find this topic to be very interesting because a lot of people do not know the effect of their emotions on their health, and also negative emotions can actually reduce the effectiveness of the medication you take. So I think this is very educative. You're going to learn a lot, so stay tuned.
All right, so we'll just go straight into it. She has actually given us tips and things you should expect, right? So, Dr. Claire, can you educate us on what poor emotional regulation is?
Right. Poor emotional regulation is the difficulty in managing or processing your emotions in stressful, frustrating, or overwhelming situation. And these are some signs of poor emotional regulation: overreacting, mood swings, bottling up your emotions, difficulty in calming down. And I'd like to explain a little more on bottling up your emotions. So that is when you decide not to talk about it, you decide not to confront the situation, you just keep everything inside you and then you just deal with it quietly. These are
Interesting.
signs of poor emotional regulation.
This is interesting because we are in a society, especially the bottling up of emotions actually. We are in a society where a lot of people don't express themselves at all when it comes to their emotions. I mean, from childhood in Africa, we've been trained to bottle up our emotions, not
Yeah,
express
that's right.
ourselves.
That's
Your
right.
mom will beat you and expect you to be quiet and endure.
Yeah.
Right? I mean, I believe there's a place for endurance and there's a place where you express
Yes.
your emotions. Right? Okay. So I mean, and also we are also in a society where the men are taught to not express their emotions at all.
Actually,
Their men should,
expressing their emotions
yeah,
is like a sign of weakness. So
yes.
they'd rather not.
So yes, I mean, a lot of people have this very weird judgment
Yeah. Men
emotional
showing
expressions.
emotions.
Yes, and it's very bad. So I believe this episode is really going to help a lot of the viewers out there, and I'm trusting that you will share this video to people that you believe should hear
As
about
much as
this.
you can. As much
Yes.
as you can.
Okay. So Dr. Claire, now that we know what poor emotional regulation is, can you tell us how these poor emotional regulations affect our health?
Okay. So whenever your body is subjected to stress, also emotional stress, it releases the stress hormone called cortisol, also catecholamines like adrenaline, And when there is chronic poor emotional regulation, these hormones begin to build up. And the buildup of cortisol and adrenaline is actually very harmful for your health.
I see. Interesting. So you are saying that the more we choose to regulate our emotions poorly, there are certain kind of
Consequences, yeah.
consequences that have an effect on us. Can you tell us more about it? I mean, how these specific hormones affect our bodies? Because I mean, aren't they just performing their jobs, right? So how are they affecting us negatively?
All right. So first, I'm going to talk about the effect on the heart. So if you realize whenever you're angry, whenever you're under emotional stress or any stress at all, your heart begins to beat faster. So this is the effect of the hormones that has been released. So adrenaline, cortisol raises your heart rate. And over time, your heart rate stays that high and your heart begins to overwork. And just like any muscle in your body, when it overworks, it gets bigger. So when you work out your arm, the muscles of your arms get bigger. So that means the size of your heart is going to get bigger, most especially around the left ventricle. So we call it left ventricular hypertrophy. And when this happens, it can lead to myocardial infarction. That is when the muscles of your heart begin to die because it's not getting enough oxygen supply. Because the heart is now bigger, the oxygen supply to the heart is no longer enough. So then the heart muscles begin to die, and this can lead to heart attacks and sudden death.
Wow.
This is one of the effects on the heart.
Hey, this is one. So it means there are other effects.
There are a whole lot of effects of negative emotions on your body.
Hey, people are dying. Oh.
Yeah.
People are really causing death to themselves.
Exactly.
I see. I've heard that poor emotional regulation has a way of causing, or even if it's not causing, I mean, it's a trigger for diabetes.
Yeah.
Can you tell us about that?
That's true. So subjecting your body to chronic stress actually accumulates cortisol in your body. And this cortisol promotes gluconeogenesis, right? So that is when your body makes more glucose from non-carbohydrate sources. And cortisol also causes muscle breakdown. So now there is more glucose in your bloodstream, and this glucose is supposed to be picked up from the bloodstream into the muscles to reduce the blood glucose. But then there is now muscle breakdown because of the cortisol. So the blood glucose is not being able to be picked up from the bloodstream to the muscles. And also cortisol actually causes accumulation of fat around the abdomen, around the belly. And this also leads to insulin resistance. So that is when there is production of insulin. Your pancreas is actually working because there's a lot of glucose in your body, in your blood. So the pancreas is overworking, producing more insulin. But the insulin receptors are not able to bond to the insulin to pick up the glucose from the bloodstream to the muscles. So the pancreas overwork, and over time your pancreas is going to fail because it's overworking. Any organ that overworks is going to fail eventually.
Wow.
So your pancreas fails, and then your body is not able to produce any more insulin, and that leads to diabetes.
Wow. You said something that really caught my attention, that cortisol accumulates, I mean, it triggers the process of accumulating fat around the abdomen.
Yeah.
So it means people have pot belly because they can't regulate their emotions.
Yeah, we can say that.
Hey, wow.
Yeah, we can say that.
Those of you who have pot bellies, yo.
Yeah, you need to regulate your emotions properly.
I see. Okay, so is there any other disease that you have, I mean, come across due to poor emotional regulation?
Yeah, there's a whole lot. Cortisol actually causes a whole lot. Cortisol can lead to increase in your blood pressure. So if you do not regulate your emotions very well, you are going to end up with high blood pressure, also known as hypertension, because your blood pressure increases, and because this has become chronic, it stays just high, so you have high blood pressure, and you take medications for high blood pressure, but then it doesn't work because cortisol is doing the opposite of what the medication is supposed to do. So you can be left with high blood pressure and you have to take medications for the rest of your life until you decide to focus on what caused the high blood pressure. Aside that, cortisol helps in the formation of atherosclerotic plaque, right? So cortisol can lead to the increase in LDL cholesterol, that is the bad cholesterol, and so it helps in the formation of these atherosclerotic plaque, and this can be formed in any vessel. So if the vessel that the plaque has been formed is supposed to supply blood to the brain, then there will be decreased blood flow to the brain, and this can lead to stroke. If the vessel that is being blocked is supplying blood to the heart, this can also lead to myocardial infarction, heart attacks, sudden death. If the vessel that is being blocked is supposed to supply blood to the kidneys, then you have reduced blood flow to the kidney, which can also lead to kidney damage. And with this, it also activates a system called the RAS system. So that's the renin-angiotensin system. And at the end of this system is vasoconstriction, and that also increases your blood pressure, right? And also the end product of this is antidiuretic hormone, that is vasopressin, antidiuretic hormone. So it actually prevents you from urinating. So that is hypervolemia, because you're not losing the waste or excess water in your blood. So that leads to hypervolemia, and hypervolemia also leads to hypertension.
Wow, interesting. People are killing themselves and they don't even realize how they are killing themselves. And funny enough, it's it's a progression, right?
Yeah, it's
a progression. So right now you think that, oh, let me just chant this emotion down, and you're not dealing with it. Honestly speaking, one of the reasons why I felt we should talk about this is because not recently though, but anyway, in a study we had in University of Ghana, one particular doctor came to the research department, and he was telling us that he has seen a trend that is, amongst the youth, right? So like diseases that people are supposed to suffer when they are old, they are rather suffering those diseases when they are young. And it brought my mind to the fact that youths of these days, or probably even the young ones, are not regulating their emotions well. This could be like triggers. So today, someone did something wrong to you, and instead of addressing it and making sure that you are not going to think about it anymore, you rather choose to channel out that emotion and rather say that, oh, this one I can do better, and then you just forget about it. Meanwhile, you've not forgotten about it too.
Yeah.
But you're rather killing yourself, as a matter of fact.
Exactly.
And another thing that I came to realize is that I spoke to one clinical psychologist, and she said that the heart learns from the brain. So whatever goes on in your mind, and as she was saying, whatever goes on in your mind is what happens to your heart. So every single time you are holding grudges, you see this person, you're holding a grudge with this person, you're always fighting with this particular person, your heart will be taught to beat at a particular rate, which is not the normal rate. And eventually it will lead to that. Can you say something about that?
Yeah, that's very true. The human system is designed in a way that it adapts to changes. Your body is able to adapt to changes. And the downside of this is that it doesn't only adapt to positive things, it also adapts to negative things. So if you're someone who always gets angry, you realize that it is a continuous thing. It doesn't just happen once. You even get angry quicker, and as time goes on, your temper just gets worse and worse and worse. So your body adapts to it, and with this, it teaches your heart how to beat, the rate it should beat, and it stays like that over a long period of time.
That's interesting. So you see what you're doing to your body. They don't change. Anyways, Dr. Claire, thank you very much for this insight. So to the next question. Does poor emotional regulation affect the way your body fights diseases?
Yeah, that's a very valid point. So, yeah, we're still talking about the cortisol, the stress hormone. So, increase in cortisol or accumulation of cortisol actually reduces your WBCs, that's your white blood cells. And these white blood cells is what helps your body fight infections. So, if this is reduced, then it reduces your immune system. It weakens your immune system actually and makes you weaker. It makes your body unable to fight infections as it's supposed to.
Oh, I see. So you are telling your body that if you are sick, your body should not fight the diseases. So either be there or not heal. Okay, so I think I came across a study that was also talking about how people who regulate their emotions poorly
Yeah.
are exposed to getting ulcer.
Yeah.
I see. Can you tell us about that?
Yeah. So with this cortisol, it also messes with your metabolism. And cortisol, it messes with the digestion, absorption rate, and most importantly, it messes with the acidity content of your stomach. So it's able to increase the acidity or the acid levels in your stomach. And this tends to wear off the mucous membrane lining your stomach. So then the acid now begins to eat into the muscles of your stomach, and that causes excruciating pain, which is
Wow.
likened to ulcer.
Wow. So those of you suffering from ulcer, it's not it's not a food though. Some of you have eaten some, but I still got ulcer.
Yeah, yeah. Check your
Yo,
emotions.
check your emotions. Anyway, so we are moving to the next set of questions. And yeah, Dr. Claire. So now that we've known how poor emotional regulations deteriorate our health and also affects the way our body fights diseases. The next question is, how then does poor emotional regulation affect the effectiveness of the drugs we're taking?
Okay, so first of all, I'm going to talk about the liver, right? So, um, the increase in cortisol also messes with the liver enzymes. It's able to increase or decrease the liver enzymes. Most medications are metabolized in the liver. So, if the liver enzymes are increased or reduced, it decreases the effectiveness on the drug. Also, when we talk about excretion of the drugs from your body, it's mainly done by the kidneys and by the liver. So, with this cortisol, the blood flow to the kidney is reduced, blood flow to the liver is reduced. This in turn reduces the function of the kidney. So, the kidney takes more time to flush out the medication from your system. So the medication stays in your body longer than it's supposed to, and that can lead to reduced effectiveness of the medication. Also, with the acidity of the stomach, when you take the medication, for example, with medications that need acidity of the stomach to be absorbed, for example, some antibiotics and iron tablets, it needs acidity. But because cortisol is messing with the acid levels, the absorption of this medication is no longer effective, or
I
is
see.
is not.
So it's like the poor emotional regulation, or let's say the cortisol and adrenaline that are released in excess,
Yeah,
are causing the body to fight the drugs we are taking, like
exactly.
drug resistance.
Exactly. The medication of not necessarily drug resistance, but then it reduces the effectiveness of the drug.
Drug.
Yeah, by increasing or decreasing the acidity level of the stomach
Oh.
or the liver enzymes or causing damage to the kidneys
Wow.
and the
So
liver.
it's not that the drug is going to go away because your emotions are poorly regulated, but that particular drug you are taking to heal yourself can cause other diseases.
Yeah, it can
because-
cause other side effects because
Wow.
it's staying in your body longer than it's supposed to.
Wow.
And also, you can be taking medicine for a very long time and you never see the effect, because poor emotional regulation is doing the exact opposite of what the medication is supposed to do. So, for example,
Interesting.
when we give someone high blood pressure medication, it is not supposed to be for a lifelong. You're not supposed to take the medication for the rest of your life. But that is what we see going on. People are on high blood pressure medication for 10 years, 15 years, and they're going to be on it for the rest of their lives. And it's got more to do with your lifestyle changes, especially with emotions. So the medication is working in a way that is supposed to bring your blood pressure down, but because of your emotions and lifestyle, your blood pressure is always rising. So then you will always depend on the medication to bring your blood pressure down, which will never normalize. It will never go down because your lifestyle is still always bringing it up.
Wow. I'm shocked right now. Like I don't even know. People are so like. Have you like experienced like? Have you gotten like patients who are in that sphere of experience before?
Yeah, so I'll talk about two category of patients.
Okay.
The first category of patients I have personally dealt with patients who have high blood pressure, but we haven't yet started the medication. Normally, what I do is I don't start the medication. That is not my first line of treatment. I give advice. So we talk about emotional stress. We also talk about what they have to eat, because that's also very important. So what you eat, the fact that you need to exercise, and we come to emotional stress. So we talk about what is worrying you, what you think about, what is putting your body under stress, and we begin to deal with that. We work on that. We make sure we are focusing on that part, taking away the cause of that, and I always see improvement. The blood pressure begins to normalize
Wow.
even without the medication.
Wow.
And the other group of patients are the group of patients who are already using the medication. So I have people using medications for 10 years, 15 years, 20 years. They think they have to be on the medication for the rest of their lives. But then we incorporate these lifestyle changes. We talk about emotions. People are going through hurt. Their best friends have hurt them, family hurt, and all of that. We talk about all that. So this is actually you punishing yourself for what someone has done to you. If you decide to keep all these negative emotions, thinking I'll never forgive this person and all of that, it is you hurting yourself, punishing yourself for the wrong of another person.
Wow.
So if they get it this way, they begin to work on it, they begin to let go, and even on the medication, the blood pressure begins to normalize, and then we reduce the medication and we reduce it until they come off the medication, because with blood pressure medication you can't just stop it at once. So we have to reduce it and reduce it and reduce it, and they're able to get off the medication just by adding lifestyle changes and proper stress management.
Wow. She said something very profound, that you're rather punishing yourself, and it's not the person punishing you because you are choosing not to forgive the person, or you are choosing to hold on to that emotions. You need to heal from that, because in fact, sadly, we have so much information on pathology. Like a lot of people are talking about how um, what pathogens cause diseases, your eating habit, but no one seems to talk about how your emotions is actually progressing that disease you have, and it's bad. So, Dr. Claire, finally, this is supposed to be an advice to those out there, and even me myself. And I think I'm a victim to some of the things. Yes, tell us about how proper, like some of the proper emotional regulation habits we can take, and how it can help us as individuals, even in our health and lifestyle.
So first of all, you need to identify the source of the stress. You need to identify where it's coming from.
Okay.
If possible, walk up to the person, to the situation, confront it, talk about it, and make peace. Aside that, you can also use distractions. So if it is music that you want to play, instead of thinking about it, You can play music, decide to dance, decide to sing along, just to get this off your mind. So no one can ever be there and say, I don't want to think. You sometimes find yourself thinking about this, especially when you're hurt. It just creeps into your mind, and then you find yourself thinking about it. But there is a point that you're thinking that you realize you're thinking too much, and that is the point you can actually do something about it. So at that point, you need to intentionally put something in your mind. You need to decide that I'm not going to let this bother me anymore. So you set that aside, but you need to intentionally fix your mind on something. Put something in your mind. Speak the word of God over your life. Speak the word of God over your heart. Put something that makes you happy in your mind, because if you leave your mind blank, it's going to creep back into your mind. So you fix something else in your mind. You can also practice breathing exercises. So breathing exercises helps you reduce your heart rate. You can just try it. Take a deep breath through your nose for 6 seconds, and then you bring it out slowly through your mouth. And then you repeat it and repeat it. You realize your heart rate is slowing down, and that saves you from the rapid heartbeats, tachycardia, and all. Also, speak to someone. Talk to a family member, talk to a friend that is trusted, someone who will not make it worse. Talk to someone to get this out of your heart, out of your mind.
Yes, thank you very much, Dr. K. So please, as she has said, you guys should find a way of regulating your emotions rightly, and it's going to help you. Numbing your feeling is not a solution. Chunking it down is not a solution. You have to find a way to talk about it, deal with it, deal with your problems, deal with your emotions. And to go along, stop punishing yourself because of
Someone's mistake.
Yeah, someone's mistake actually. Stop punishing yourself, and it will go a long way to help you. So this brings us to the end of today's episode. I trust that you learned a lot and that you apply every single thing that has been shared with you here. So please, in fact, I know I'm speaking from prophecy. Go for therapy. Go and sit down with a psychologist. Talk about your emotions. Let that person help you.
Yeah, that's right.
Anyways, so this is where we'll come to an end. It was really a lovely time spending with you people. So we'll come your way again, and in the next episode, we have another interesting topic to talk about. So till we meet again, stay safe, live well. Dr. Clay.
So thank you so much for joining. Don't forget to like, share, and follow for more. This is Barian Health, where truth meets wellness.
Bye.